and it has been a personal pleasure to work closely with some medical students from IFMSA, organization that I've been involved some good years ago, and it's been a pleasure to work with you. And today I'm very well joined by my dear colleagues who are also psychiatrists, and we are going to present different angles that are important to take in consideration nowadays from a mental health perspective, and in a time that we are all living so many difficulties in this pandemic. And we are working together with the support of the early career psychiatry section of the World Psychiatry Association that I'm the current chair, which is a section that is particularly interested in education and also to empower younger people and trying to provide as much education to people and to medical students that are from all countries around the world, high income countries, low and middle income countries, to find strategies to improve the healthcare and education globally. And so today we will have three main presentations, and at the end I believe we will have some time from Q&A. It would be great to know the colleagues that are joining us today and where you are and what's the situation that you're facing, and to know a bit more about everyone here. So the first presentation will be the impact of the pandemic on mental health and psychological well-being, which will be presented by Dr. Lamia Essam from Egypt. And then we will follow to a discussion on mental health of health workers, students and junior doctors, addressing challenges and opportunities, which is going to be covered by my colleague Dr. Olasom Peter from Nigeria. And then last but definitely not the least, we will discuss strategies to maintain positive psychological well-being during these times by my colleague Dr. Francis Aduku from Nigeria. So I will pass on to you, and thank you so much for inviting us to this discussion with you today.
Thank you so much, Mariana. And just to also give you background, the speakers, we have convened today the AMEE Student Task Force. So AMEE is the International Association for Medical Education, and annually we have a global cohort of students from around the world who are pioneers in medical education in their context, and that includes mental health as well. And you can see, I think so far, about 40 out of 72 of us, and they come from all landscapes and all regions. And I think the STF are very enthusiastic to have you as well with us. That being said, I think we can formally start the webinar now, and Lamia can go. Lamia, can you hear us?
Yeah. Good afternoon. How are you? Can you hear me?
Yes, we can.
Yes.
Is it good now?
Yes.
Hey, hello everyone. I'm proud to be with you today. I'm from Egypt, House of Fisher at Al-Damardash Teaching Hospital. It's one of the biggest hospital in Egypt, teaching hospital. I'm happy to be with you today. I'm preparing the screen.
Yes, sure. We will let you know as soon as we can see the screen.
I'm preparing to share it.
Lamia, are you facing a little bit of difficulties?
I'm preparing to share it, but it's a bit difficult to share it.
Okay, if there's any way we can assist you, just let us know. Lamia, if it will take you a little bit of time, can we maybe start with Francis and then come back to you?
Okay, we can do so.
Perfect. Thank you.
Welcome.
Okay, so should I go first?
If you like, yes.
Okay. I'll share my screen. Just 1 second. Slideshow. Okay, so hello everyone. I am Dr. Frances Adiuku. I'm a consultant psychiatrist from the Department of Neuropsychiatry at the University of Port Harcourt Teaching Hospital in Nigeria. I will be talking today on strategies to maintain positive psychological well-being during these times. And these times we mean during the COVID-19 pandemic. Okay, so to start off, we need to understand what we mean by psychological well-being. According to Carol Reeve, psychological well-being is a state of balance, of psychological balance, and it has to do with your experiences, you know, when you've had both challenging and rewarding experiences, and how you come out of it, and come out of it balanced and fulfilled. And it has 3 dimensions to it. It has autonomy, personal growth, positive relations, purpose in life, self-acceptance, and environmental mastery. And I'm sure, because I'm meant to have come last, we would have looked at how the pandemic has affected our lives in these ways, and therefore why we are prone to have mental health problems during the pandemic. But I'll just talk on that briefly so that we can understand the rest of it. So why is psychological well-being important? It is important because, you know, high levels of psychological well-being has been shown to be protective against mental illnesses and psychopathology, and all in all, it's related to longer life, you know, and therefore it's quite important that throughout life we need to have this balance. We need to have high levels of psychological well-being. So the COVID-19 pandemic has had, of course, negative effects on our psychological well-being, and as such on our mental health as well. It has, right. So because of that, because of the pandemic, we've had loss of autonomy. Now, autonomy basically is your ability to have control over your life. And with the movement restrictions, the lockdowns, and the physical and social distancing, a lot of us, there has been a loss of autonomy for a lot of people, especially the elderly. And this has had a negative impact on the quality of life overall. There's an increase in loneliness during the pandemic, and that of course leads to increase in anxiety, depression, suicide, and insomnia. The pandemic is expected to have a devastating effect on personal growth. Now, if you're looking at in terms of our schools, for those of us that are students, we've had to stop going to schools or going online. Most people have lost their jobs due to the economic effect of the pandemic. Even those who have to work, a lot of opportunities have been stopped. For those in residency training and those that have had exams, a lot of exams are put on hold this year. And so a lot of personal growth has been put on hold for a lot of people. And of course, this is going to have a negative effect on psychological well-being. So despite all of this negative effect of the pandemic, there is still room for growth and good mental health. And how do we do that? Well, if you look at the diagram, we see that a lot of things come into play to have a balanced psychological well-being. So we need to have a feeling of safety, as well as have purpose. You know, we need to instill hope, have some form of resilience, have meaning in our lives. We need to be empowered, to have gratitude for the fact that we are still alive. And while trying to be safe, we need to have some control over our lives. That is in terms of our autonomy. There needs to be optimism, self-esteem, and attachment despite the physical and social distancing. So how do we encourage autonomy? Now, we have to obey the physical and social distancing because it's meant to keep us safe. But despite these restrictions, the lockdowns and movement restrictions, we still need to encourage autonomy in a certain way. We need to have some form of independence, freedom, and self-reliance. So especially for those who are at an increased risk of having the COVID-19 infection. So while we say, okay, you know, you're not allowed to leave the house, but it doesn't stop you from having certain controls over maybe close-knit family meetings. You can join those ones, join it online via Zoom to make sure that you're still connected. You know, you still have to decide. The decision should be with you whether you need to go to the shops on your own or have someone else go for you. So those little areas where you can actually encourage someone to have control over their own lives is very important in order to maintain positive psychological well-being. We also need to create room for personal growth. Now, despite the pandemic, there's always room, you know. So there is an opportunity for post-traumatic growth, especially for those who have endured severe negative or emotional struggles. So we can actually view the pandemic as a shining light on things that are most important. So rather than focusing on the things that we have had to forgo, we can focus on the things that we have, you know, we have opportunities to do. For example, maybe if you are at school or you're working, you wouldn't have enough time to spend with your family. But because of the lockdown movement restrictions, you are now being forced to stay at home. And you can see that as an opportunity to foster bonds with your siblings, your children, your parents, and that can actually improve your overall quality of life and give you some higher levels of psychological well-being. So in doing that, socialization is necessary. and it improves psychological well-being. So, but the emphasis is on positive social interactions. So while we are on social networks and social media, having our Zoom calls, we need to focus on the positives. So rather than getting into heated debates about politics, we should focus on, good memories, talking about our plans at the end of the pandemic, traveling. We need to express gratitude for being alive, perform acts of kindness. For younger people, having to maybe do shopping for an older person and have it delivered. Those acts of kindness can actually improve your relationship with others, and it gives you a sense of fulfillment. We should also practice mindfulness. Practice mindfulness, being present in the now, and enjoying what you have, the opportunities you have, is very important. And we recently wrote a paper on the positive effect yoga has, especially during this time. And as we know, it's been shown that during times of trauma and psychological distress, especially like as a pandemic, practices of yoga has been shown to be very effective in reducing anxiety, depression, and giving an overall positive psychological well-being. So how do we bring back purpose to our lives, especially when we feel like life has been put on hold, everything you've planned for the year has sort of been taken away from you? How do we bring back purpose into our life? By supporting others in achieving their own goals, we tend to find some form of fulfillment. If we focus on what we can change and accept the things we have no control over, that sort of instills some form of purpose in our lives. By living by our values, despite what is going on around us, sticking true to who you are and doing the things and doing those things that you are privileged to still do, will actually will keep some sense of purpose in your life. Being kind to yourself and treating your body right. So eating right, sleeping right, exercising is very, very important at a time like this. Accept that feeling anxious and fearful at this time is normal. A lot of us would have, at one point or the other, felt afraid, fear of contagion, fear of transmitting it to someone else, especially being in the medical field. And that fear is normal. We should accept that that's normal and, come to terms with it, rather than trying to avoid thinking about it. Because the more you avoid it, the more it becomes bigger than what it actually is. And then adapting to the changing tide and situations globally. Well, okay, so maybe this is the time for you to travel on holiday and you can't travel on holiday. You adapt, you do your Zoom meetings, and like we are doing now, we are having conferences online, and we are adapting to that, and we are still making an impact as little as we can, but we're still making an impact. And that gives you purpose in your life. It tells you that your life shouldn't be on hold because of the current situation. Now, for healthcare workers, we understand that long hours, there are longer hours at work for us now. Our workload is heavier, and then there is the associated stigma, in dealing with the pandemic, because the general population would assume that because you're a healthcare worker, you are a frontline worker, and therefore you are going to transmit disease. All of this has been shown to lead to mental health problems. So how do we rise above this? Well, one of the things is that we need to develop a support network. During this pandemic, I have my own support network of early career psychiatrists, and we, during our difficult times, we just express ourselves, and we are a form of support to each other. And during all of this, find time to rest. Resting, when you have longer hours and heavy workload, I think it's best that we alternate it with shorter hours and less workload, because if you keep going, you'll break down. So we need to alternate it. We need to talk about our feelings. It's not a bad thing to admit that you're exhausted, you're tired, you're anxious, and you're worried. And have access to mental health services when necessary. And of course, exercise, communicate positively, and healthy living, healthy eating. Reduce as much as you can alcohol, because it has been shown that it doesn't actually help solve the problem. So I've been going on about exercise and why? Because it's very important. The effect of exercise on psychological well-being is very important. One, it builds friendship, because when you exercise in groups, you tend to have positive relationship with people, and that would help improve your psychological well-being. Exercise can help give you a more positive view about yourself. You know, you feel better because it releases endorphins and you end up feeling better. It improves your mood, it reduces your chances of anxiety, it helps reduce depression, and it gives you mastery, which is the environmental mastery. You are able to, you know, you are sort of in charge of the situation in which you are in, and you know, it improves psychological well-being. It improves your cognitive function. So when you read, you understand better. It gives you a positive outlook in life. It helps improve your sense of purpose. And it gives you a room to grow because you challenge yourself. And when you challenge yourself, you grow. And when you grow, it's sort of like you are having more purpose. You wake up every day and you have another task to achieve. And so exercise is very important, especially during these times, to help keep yourself in balance and help improve your psychological well-being. So I'm hoping that with this little presentation I have done, that we can pick up strategies and then we can discuss them later, how we can actually incorporate some of these into our lives where we are finding difficulties, and how we can improve our psychological well-being, improve our state of mind, and help keep mental illness at bay. Thank you.
Thank you so much, Dr. Francis. You certainly highlighted some useful facts that we were also discussing in our team, and we will address the questions in the end. So we will also have time then to answer. Dr. Lamia, is your presentation ready, or do you need some more time? You can also send it to me if you need me to share it. Could you hear me? Okay, I think it can work.
Is it working now?
Well, I can see myself, so probably I will see the presentation.
Shared or not?
Well, we don't see the presentation, we just see the Zoom windows.
Can I send the presentation to you?
Yes, please, you can. I will send you my email here in the chat.
Okay. Medical skills?
Yes.
Okay, I will send now.
Were you able to send it?
Yes.
Okay. I still didn't receive it yet. I was just wondering, so we don't delay the presentation as it may take some time with the servers and so on. Can maybe Dr. Peter go next? if there's no problem with any of you. And in the meantime, I will prepare the presentation and receive it, hopefully. Do we have Dr. Peter with us?
I don't think he's in. We have been trying to contact him over WhatsApp, and he has had his phone switched off for the last hour or so. So I don't know if something happened, but yeah, I will let you know as soon I know something.
Okay, thank you, Dr. Mariana, because in the meantime, I'm still waiting for the presentation and I didn't receive it. Maybe Dr. Lamia, you can also forward it to the other email address that was provided in the chat, Mokshada Sharma. Okay, I think I received it. Yes. Okay, it shouldn't take long. Okay, Dr. Lamia, we are ready for you. I received your presentation and I will start sharing it now. Is it okay with you? Dr. Lamia? Dr. Lamia, could you hear me?
Dr. Lamia, can you hear us?
I think Dr. Peter is available now, so he probably can go next.
Did he join us here on Zoom? Because I can see that Dr. Lamia has some connection issues.
I'm back.
Oh, okay, lovely. I was sharing, I'm still sharing your presentation. Do you want to proceed? Is it fine if I?
Yes.
Okay.
Thank you so much.
Have fun. Whenever you're ready.
We're talking about how has COVID-19 affected our mental health. The pandemic and the subsequent restrictions to prevent the spread has profound impact on the mental health of young people and adults. Some groups have been affected more than others. Half of the adults and over 2/3 of young people have been affected. And they said that their mental health got worse during lockdown. Young people are more likely to have experienced more poor mental health during lockdown than adults. And this is remarkable. People with experience of mental health problems are more likely to see there. So the people at risk were the young and those with previous mental health problems. Mental health worsened as a result of coronavirus restrictions. Many without previous experience of mental health problems has experienced poor mental health during lockdown and have seen their mental health and well-being decline. So there is a general decline in mental health and well-being, even for those who have not been experienced mental health previously. People with very normal and good mental health over the past months experienced being more anxious about all sorts of things and crying about the things, which is not normally. Decline and sleep problems. They feel alone, they feel lonely and isolated because of the restrictions and the lockdown and being absent from their work, their actual life. Most people's mental health has got worse during lockdown. Over a quarter of adults surveyed, their mental health has stayed the same, while some of them said their mental health has improved. Two-thirds of adults and three-quarters of young people experience mental health problems said their mental health has gotten worse during the lockdown. How has your mental health changed in the past 2 weeks? The most said it worsened. Young people most likely to say that the pandemic had worsened their mental health. And about a third said the current mental health lockdown and their mental health got poor. However, young people reported worse mental health, with nearly half saying that their mental health was poor or very poor during lockdown. Just over a third said their mental health was ok. People with or without experience of mental health problems reported poor mental health and well-being during lockdown. Mental health continued to decline throughout lockdown. People's mental health has continued to decline at the same rate throughout lockdown. Since the beginning of April, fewer people felt optimistic about future in the weeks after that. After the announcement of new restrictions on May, they said the survey has not tracked individual participants over time. We all thought the lockdown would be over by now and the things would be getting back to normal. It feels like the longer this lasts, the more hopeless everyone is getting. People with eating disorders, OCD, PTSD, and personality disorders are affected more than those with other diagnoses. Because in OCD, The obsessions about getting the illness have increased, and the PTSD about death about losing someone they love. This is a study case. Anna lives at home with her parent. Anna was diagnosed with OCD at 11 and spent time in psychiatric hospital 3 years ago to manage her eating disorder. Despite not leaving the house to exercise during the pandemic, Anna was incredibly worried about catching coronavirus and passing it on to her family. While she wasn't that concerned about this, at the start of the lockdown, she felt her worsening OCD symptoms were making her overthink it. That consistent stream of negative global news increased her anxiety. Some demographic groups are facing greater challenges with her mental health than others. Those with disabilities, learning differences, and long-term illnesses. Those with a long-term health condition or learning difference are more likely to have had poor mental health during the pandemic and to have seen it decline throughout the lockdown. Another study case, Paula lives in a North Tennessee with her son. For someone like Paula says, lockdown has been a nightmare. Paula has experience of OCD and health-related anxiety. Paula also has a range of physical health problems, suffering from fibromyalgia, ME, and osteoarthritis in her knee, and was diagnosed with autism 3 years ago. It's been imprisoned in your own home, Paula said. Unable to get out and about without aid, she was unable to enjoy the daily outdoor exercise breaks many of us took advantage of. She used to enjoy a stroll on the beach on her wheelchair, but with the beaches shut, getting out and about, while also staying safe, become difficult. Young people aged reported worse mental health and well-being during lockdown. All other age groups are more likely to have seen their mental health get worse during lockdown. Half said the mental health was poor, and three-quarters have said their mental health get worse during the pandemic. Another study case, Ali identifies non-binary lockdown began just he had begun a new chapter moving into a new flat. Ali has also been related to self-harm and suicidal thoughts since we're 13. Ali began lockdown with go for it attitude, downloading the Coach to 5K application and starting to experiment with cooking. However, by week 2, things become more difficult, especially during living alone. Ali was challenged by the lack of face-to-face contact, and despite regular FaceTime calls with friends and family, it of course didn't quite match the benefit of seeing people face-to-face. Their job is not very social, and Ali can spend up 8 hours of the work day having not spoken to a single other colleague. Living on their own also means that Ali became more anxious about the new social rules. People experiencing social deprivation, people living in social housing, a proxy of social deprivation, were more likely to have poor mental health and have seen it get worse during the pandemic. Even the non-employed people looking for work said their mental health was getting poor. People whose employment status changed as a result of coronavirus, those who were changed jobs or lost their jobs due to corona, saw their mental health and well-being decline slightly more than those whose employment status didn't change. And this is logic. The sudden changes with the coronavirus in employee and jobs. Another study case, Elise, a black male with bipolar disorder in her early 50s, spent the pandemic alone on the bedroom flat. Prior to the lockdown, Elise was working in sales for local business. However, he was since made redundant with no opinion. Left feeling unsure, Elise applied for universal credit and was forced to come to rent, spending the next few months on an income which would barely cover rents and food bills. While looking for a new job, however, Ellis used his newfound extra time to do more DIY and exercise more than he normally would, which he said significantly helped him coping during this period. To sum up, those who were in much risk for a poor mental health, the young people, those have changed their jobs, those who lost their jobs, those who lost some of her friend or family, those with learning disabilities, those with a previous mental illness, and those who are alone, those who are totally present and with no face-to-face contacts, those with OCD and PTSD and eating disorders. All of these were the most risky people. Thank you.
Thank you, Dr. Lamia. Dr. Mariana, did Dr. Peter join us?
I believe so. Dr. Peter?
Yes, I heard you. Hello.
Oh,
Perfect.
Lovely. We can hear you. Are you able to show your presentation?
Okay. Sorry
Okay.
for joining me.
No worries. Are you facing any issues? Dr. Peter, are you facing any issues with the presentation?
Yeah, I thought my slide.
Can you please repeat? You were cutting.
Yeah, I thought you will help me get my slide, my presentation.
You can send it to me now. I at least didn't have them, and Ala unfortunately is not available due to another commitment. But you can share them. You can send them to me, and I will share them.
Please, can you chat me your
Yes,
mail?
yes, I just did.
Okay. Okay. So sorry, I was actually waiting. I didn't know that. Okay. Oh. Okay. Oh. All right, I'm sending now. Oh. Okay. Medical. I've sent.
Okay, it should be in my inbox any minute, hopefully.
Yeah. Sorry about that.
I just received it. It shouldn't take long, just a second.
All right.
Okay, I can start the view mode, and I just kindly ask you to tell me when to change the slides.
Okay, thank you.
Not a problem.
So good afternoon, everyone. It's a privilege to have this opportunity to present the topic, mental health of health workers, students, and junior doctors, challenges and opportunities. So as I've been introduced by Matilda, I'm Dr. Peter, and I'm a consultant psychiatrist in Nigeria and a lecturer at University of Lagos. I also run a private psychiatric mental health facility here. Going straight to the next slide, if you look at the background of our discussion this afternoon, we're trying to look at COVID-19, the effect that it has on health workers and students. By health workers, we mean the junior doctors, the senior doctors, we mean the nurses, pharmacists, and cooks. So it's a very broad topic. Health workers, pharmacists, because these are all health workers. But we'll try to cone it down to junior doctors and students as well. Let us know that COVID-19 has affected a lot of people's mental health. whatever mental health situations we have is real. Fear of getting infected or infecting their loved ones, grief, bereavement, because people have lost their loved ones. The lockdown effect, some people have not been at home for such a long time. They are always on the run, and now you are putting them in a place, no movement. They feel out of control. They can no longer control their lives. All these and fear of uncertainties. You know, junior doctors, medical students are not immune from this. So move to the next slide. And it is important for us to understand that the psychological response of frontline workers, because we can use this interchangeably. The doctors are in the front line, medical students, everybody, the health workers generally. So we can also be called the frontliners. And the truth is that the response, the psychological response is complex and nobody can understand everything. Studies regarding the 2003 SARS gives us, you know, an example of what happened. Outbreak from Canada, Taiwan, and Hong Kong have discussed how the battle against SARS led to a huge psychological mobility. So the SARS virus that plagued the world in 2003 had been found to have a lot of psychological, and it's always good for us to learn from the past so that we'll be able to know what we likely. And studies like this are so important because it will help us to predict the possibilities of likely psychological mobility that will occur even after the whole this pandemic is over. So we're not caught unaware. Next slide, please. Now, during the 2003 SARS outbreak in Taiwan, nurses, for example, working in SARS units suffered from more depressive symptoms. That was what this study found out. The nurses had depressive symptoms, they had insomnia, they could not sleep, and these were compared to those from non-SARS units. And occurrence of psychiatric symptoms was associated with direct exposure. You know, they did a cross analysis and they discovered that the more you are exposed to caring for people with SARS, the more your depressive symptoms and insomnia. And even after 3 years of SARS outbreak, a significant number of related hospital workers in China experienced some form of post-traumatic stress disorder. So we are even saying that after this pandemic is over, we should not just go to bed. Researchers should be on the lookout. Mental health experts, all of us should be on the lookout to identify the fact that even years after, people may still be suffering from whatever effect that has started now. Next slide, please. Similar unavoidable stress, fear, and anxiety about a poorly known contagious disease outbreak like COVID-19 can be profound among the higher risk group, such as the healthcare practitioners and other frontline workers. And not only that, bankers, policemen, armed forces, and students. Because the truth is that once you don't know the full epidemiology, the full mode of transmission, there's no treatment, there's no vaccine for a particular illness such as COVID-19, then that's uncertainty. Anytime a man is in a state of uncertainty, human beings are likely going to exhibit fear, stress, and anxiety. And that is why whatever we are seeing now is a real mental health issue because of these conditions. Next slide, please. It's also important for us, talking about challenges of COVID-19 on healthcare workers, students, and the likes, that medical professionals from heavily COVID-infested countries like China experience huge performance pressure. A study was done in China. It was discovered that the medical workers experienced a lot of performance pressure. The junior doctors especially, because they had to answer to the attendants, they had to, they had to be on call severally, as well as increased unfavorable psychiatric outcomes owing to sudden surge of overwork, inadequate protection from contamination, frustration from failure to give optimal patient care, and isolation. The truth is that as doctors, we're trained naturally to save lives. And when you try yourself, you try all you could to save a life, and eventually you just see the person going down. That thing comes to your mind, and doctors begin to blame themselves. Oh, you see a lot of pictures on YouTube, videos people crying. Maybe I could have done my best. Maybe I could have done this. All these lead to a lot of performance anxiety and frustration. And
Dr. Peter, are you still with us?
yeah, I'm with you, please.
Okay, you were just cutting. Okay, sure, go on.
Next slide, please.
Yes.
Off my data in order to prevent any call from coming in. Okay. So various types of psychological trauma, stressful events, vicarious traumatization among the nursing staff have been reported during the spread of control of COVID pandemic in developing countries where the healthcare system is already overburdened. Surges of COVID cases are likely to provoke acute anxiety, irritation, and stress among doctors. Still talking about the challenges and the effects that these will have on health workers. Let's move. Now, there's a very interesting study by Lee et al. In their nationwide study among healthcare practitioners working in fever clinic or treating COVID patients during the 2019 coronavirus outbreak, it shows that half of the respondents identify at least mild depression. Half of the respondents identify mild depression, and 1/3 reported insomnia. Whereas 14% physicians and nearly 16% of nurses describe moderate or severe depressive symptoms. So these are studies that are real. These are evidence of the fact that junior doctors, healthcare workers go through a lot of psychological trauma. And most, the notable among these trauma include depression and insomnia. Next slide, please. Researchers pointed out that being female and working in the front line were direct and independent risk factors for developing abnormal stress symptoms. Amanda et al. Showed that caring for fellow ill colleagues during the pandemic may heighten anxiety of hospital staff regarding their competence and skills, making them more vulnerable mentally. Do you know, it is, if you look at it, it is very painful to watch a colleague die. It is very painful to be in charge of a colleague and you feel you don't even know so much about this particular illness. And the sense of helplessness makes one to become even more vulnerable. And it is important because we're looking at factors, we're considering challenges, we're considering what are the things that may affect the mental health of an average junior doctor, medical student, and the likes. So it is important to identify these risk factors, and it will help us to prevent the psychological sequelae that may follow. Next slide, please. On the contrary, non-essential healthcare staff who are not involved in direct care of patients with COVID-19 and thus have to stay at home for a definite period during lockdown may experience feeling of isolation and worthlessness with respect to their inability to effectively contribute to the present crisis. In this situation, there are some health workers that were asked to stay at home. There are some that, were not in the front line. What this study tried to show is that being in the front line, yes, can make one to be susceptible to the mental health effect of COVID-19. Is also saying, even if you are not in the front line and you are at home, the feeling of isolation and the sense of worthlessness that, oh, Everybody is clapping for the frontliners. Everybody is in the front. What am I doing? I can't do anything. That sense can make one to feel helpless and worthless. And one can have that sense of inability to effectively contribute his own or our own quota. So all these further affect the mental health. So whether one is in the front line or one is not in the front line, studies have shown that they are both exposed to mental health conditions. Next slide, please. So now, addressing the psychological aspects, like fear and anxiety of critically ill COVID patients, seem furthermore difficult and cumbersome, as most of the hospital and their staff have scarce formal training on proper infectious control, as well as behavioral and mental health intervention during and after infectious disease pandemic. So apart from the direct care, apart from the fact that one feels worthless if it's not in the front line, apart from the fear of anxiety, the fear of uncertainty, apart from the grief and bereavement of watching one's colleagues get infected with the possibility of the person dying, even when you look at, especially in developing nations, you have inadequate materials. Some of these hospitals are short-staffed. So at the end of the day, in fact, some don't have infectious control measures in place before all this thing broke out. And so you see hospitals trying to, develop protocols, because there was nothing on ground before. All these bring a lot and enormous mental health stress on frontline workers and junior doctors and medical health in particular. Next slide, please. So, still talking about challenges, health workers can find it extremely difficult to deal with dismay, uncooperative, and panic-stricken and stigmatized patients of COVID-19. And this may generate apathy and withdrawal among clinicians. For example, I happen to be part of the psychosocial support here in Nigeria. Sometimes our work is to either talk to those who are in quarantine or in isolation, or those who have been discharged, or those who are in active care, or the general public. Sometimes those who have been discharged, or sometimes those you want to discover, you want to break the bad news, as it were. Sometimes you are lashed at. Sometimes some of them will bang the phone on you. Sometimes some of them will be angry and talk to you anyhow. Sometimes some of them will put their frustration on you. There were some of my colleagues who refused to pick calls or who refused to contact any COVID-19 positive patients any longer because they were verbally abused and verbally attacked. Of course, while you try to understand our colleagues rejecting these calls, you also understand the kind of frustration that patients who have been positive or who are uncooperative, what they are also going through. Some of them are displacing the anger on the health workers that eventually try to call them or try to take care of them. So there's a reaction, there's a counter reactions, and all these are challenges because at the end of the day, it becomes so tiring and there's a form of apathy, there's a form of withdrawal. Even despite the apathy, you still want to do something, but you are trying to do something, you're also tired. All these can have enormous mental health on an average junior doctor, on health worker generally, or any student on medical rotation. Next slide, please. Many of the healthcare practitioners directly related to care of confirmed suspected COVID patients have been isolated and quarantined, remaining separated from family during an infectious disease outbreak, and this may exert enormous emotional toll. My aim this afternoon is to give us different factors, different challenges that this COVID-19 has on mental health, so that when we know these challenges, we can look at the high-risk group and the factors that have. So when we are seeing patients or we have contact with any of these patient, colleagues and ourselves as well, we can look at various ways we have been affected. Because most of us are in depression, most of us have repressed it, most of us are in denial. But when we look at this, we're able to say, oh, I went through this, I think this happened to me, and from the history, we're able to predict the possible mental health implication, and then we're able to intervene on time. And that's why this topic is so germane, talking about the challenges and cope. Next slide, please, as I round up. Those who are performing hospital duties on a daycare basis have to return to home at increased risk of developing profound anxiety. Of course, you've been in hospital for a week, now you have to go home. You have to don your PPE, you have to wear new clothes. When you get to the house, you first of all tell every member of the family to shut themselves in one room, you head straight. This was the experience of one of my colleagues. Everybody will first of all go and pack themselves in one room. She heads straight to the bathroom. She downs her clothes, put them in chemical solution, take a very warm and thorough bath. Then she comes. You can imagine how tiring and how emotionally draining this can be. And health workers have to go through this, especially if you are now having a chronically ill patient living in the house, maybe one's parents. You don't want to move near them, you don't want to infect them. COVID-19 pandemic actually came with a lot of psychological challenges. And it is true that it is a silent pandemic that is not talked about. The mental health challenges are the silent pandemic. And that's why this topic is quite robust. Next topic, the next slide, please. A sense of vulnerability and helplessness may arise among clinicians due to lack of definitive therapy and preventive vaccine. Uncertain incubation period as well. People are going to call you. What do you know about this? What do you know about this? Do you know what it is? People see doctors as messiah. They see doctors as the all-knowing. And so your friends, colleagues, family will ask you questions. And then all you tell them is, oh, research is on the way. Oh, no vaccine for now. Do you know how one feels? A sense of vulnerability and helplessness. And that can affect esteem of an average clinician. An average junior doctor trying to understand medicine, and then you have no idea because the research is underway. Vaccines are being developed. The mode of transmission are changing. Today it is not airborne. Tomorrow it could be airborne. All this puts a lot of vulnerability and a mental health stress on an average junior physician. Next slide, please. Being completely supported by government due to lack of PPE, feeling of worthlessness due to lack of training in proper infectious control procedures. Isolation can cause significant burnout. So this is to repeat what I've said earlier on as a way of emphasis. Next slide, please. News of assault on doctors after death have been reported, especially in developing nations who believe that, oh, COVID-19 pandemic, the conspiracy theories and co. We've seen cases that doctors are ejected from their quarters. Doctors are molested. Doctors are beaten by law enforcement agents because of poor knowledge as regards to the epidemiology and the nature of the illness. So apart from psychological assault, most of healthcare workers, doctors, students on rotations have gone through a lot. And sometimes even these students, some of them are at home. They have hoped to graduate. Now they could not graduate. They've hoped to have their rotations. They've hoped to do their semester exams. All these cut off. The dreams of graduating at so time, the dreams, everything shattered. All this can really affect one's psychological health. Next slide, please. So, I haven't talked so much about challenges because as much as possible, when we understand the challenges of COVID-19, the effect on health workers, junior doctors, medical students, and students in general, it will help us to be predictive. It will help us to be able to know the kind of intervention we're going to. But as they say, rounding up, every challenge produces an opportunity. What is the window of opportunity that COVID-19 pandemic has brought? Well, the truth is that it is not all sad. We need to learn from every adversity. So I look at it, resilience. Many people never thought they could withstand this kind of pressure. Many people never thought they could handle what they have done in the last 3, 4 months or 5 months. So many people have learned other ways of coping. So resilience has been built. And once resilience is built, it is like a memory T cell that when a bacteria or anything comes in, the next time there's a reinfection, it reminds you that, oh, something like this has happened to the body before, and the body defense mechanism is reactivated. So also, people that have gone through resilience now, they are able to overcome at least the possibility of overcoming likely future stress or stressors are there, unlike those who have not gone through this at all. So we could see that as opportunities. Medical students have a lot of cognitive orientation, doctors cognitive orientation that, oh, a doctor today can be a patient tomorrow. Doctors should not feel like a mighty all-knowing, because many of the colleagues also came down and they had to subject themselves. They had to learn to rest. They had to learn to run shift. They had to learn to take care of themselves and boost their immune system. All this will help. It's also important to know that, oh, when you are planning, you plan for uncertainty. So a lot of cognitive reorientation, that everything may not continue to grow the way you planned. Along the path, something may happen. It has also brought opportunity of telemedicine. Now people can talk, people can attend to clients, even right from their home, and everything will be okay. Medications will be delivered. So telemedicine has improved significantly. Telepsychiatry, telemedicine in general, and we now know that a lot can be done through the use of internet and technology, and that is the opportunity. Also, of course, research opportunities. So many research opportunities are on ground. Students can do research, junior doctors can do research, lecturers can do research on the effects, different things, and at the end of the day, when we see these challenges, we also know that there are opportunities. So I think on that note, next slide, I want to thank you for listening. And our next slide says, the end of my slide. Thank you.
Thank you so much, Dr. Peter. You had very strong points, and it was a very nice perspective that you brought, not only about how COVID affected the workplace, but what would be the other like challenges that we face and how to cope with them. Your speech was surely motivating, so thank you so much. And on an end note, thank you once again, Dr. Francis and Dr. Lamia, and Dr. Mariana for moderating. Before leaving the floor to you, STF first, in case you'd like to ask some questions, I would like to ask Dr. Mariana or any of the speakers if they want to add anything more besides what they already mentioned. Okay. Dear colleagues, we have now 15 minutes of questions. So please go ahead and feel free to ask anything to any of the speakers.
I have a question to Dr. Peter, but just to confirm, can you hear me?
I can hear you very well, Omar.
Okay, thank you. Thank you, Dr. Peter, for your wonderful presentation. So what I found interesting in your presentation is that you not only addressed the anxiety and the stress that frontline workers are exerted to, but also the psychological burden of, let's say, non-essential workers and students who have been told to stay at home for long periods of time. So what I've noticed is that these people have basically tried to use their free time, because of course no rotations at the hospital and no courses. They've been trying to use their free time to study, to work, and to do productive things, but they have found it hard to stay motivated in the absence of a regular routine. So I just wanted to hear your thoughts on this difficulty in finding motivation and being productive despite the availability of free time.
Yeah, thank you so much, Omar. The truth is, I always say something. I always say that whatever psychological effects anybody is going through now, it is real. It is real. We all have different personalities. We all have different coping strategies. I know of my students that have gone into full-time research, helping different professors, and so they are really having nice time according to them. I know those who have decided to learn other skills. I know those who have decided to read some topics over and over, those who did, the ones they did not understand before. And I know those who are already just shut in. They don't know what to do next. So you have different ways, and I've discovered that the ability to cope in this present time is hinged on several factors: the coping strategies, the skills, the motivational factors that is available for that individual, the home setting that that person is even in. Some see school as a getaway. Some of them are in abusive relationship at home. Some, the home dynamics, people like that will respond at different rates and in different ways. So all we need to do is to identify, studies should identify this factor and this group of students, and interventions in form of motivational interventions, support therapy should be given to them. This is the time that we need individual support therapy or group therapy to help those who find it difficult to cope in time like this.
Thank you, Dr. Peter.
Thank you.
Thank you, Dr. Peter. Mohammed from Egypt has a question too. Mohammed, please go ahead.
Yeah, thank you, Matilda, so much for giving the floor. And thank you, our professor, so much for your explanation. I am from Egypt, and now I am about to finish my bachelor degree in medicine, and I'm highly interested in psychiatry. And also, I have some background regarding training and coaching, if you are familiar with this term, coaching. So what I noticed, based on my experience, that especially in Egypt, that psychiatry does not focus so much about positive psychology approaches or mental well-being or social well-being and so ever. So how can I, as a junior doctor or young professional, help my community through psychiatry to spread such kind of concepts? Because usually in Egypt, coaches and the trainers usually explain this topic, not psychiatrists. So if you have inputs for this situation, I really appreciate it.
Mm-hmm. Yeah, no, I can comment on that. Well, psychiatry, as doctors, we are specialists in a number of situations that concern mental health that are particularly severe and they require treatment. And that's why in some settings, because there is also priorities, and shortage of staff, some psychiatrists are providing care in, for example, inpatient settings or in settings where patients that have worse clinical conditions are. However, psychiatry is quite broad and also focuses quite a lot as well, and it's starting to focus more and more and more in prevention and in public mental health and in approaches that are trying to support people from the general population or populations that are at risk of developing a number of symptoms. So psychiatry also focuses on those types of interventions. However, because after you do your training, you are so well prepared, let's put it that way, that on a number of occasions, you are the ones that provide treatment for patients that require, for example, like medication or ECT, but you can also, for example, there are psychiatrists, and it depends on the type of countries, but some psychiatrists, when you finish your training, you are also like psychotherapists, and you are prepared to provide specialized talking therapies to your patients. In other countries, psychologists do that. So there is a wide variation, but I appreciate your public health perspective and your public health efforts. I share it myself. I did a master on mental health policies and services because I think it's quite important to think about prevention and to think about well-being and population at large. But having said that, all of us have a health and health encompasses a number of areas, including mental health, and psychiatry is dedicated to that. But as psychiatrists, we also need to take in consideration and be very aware of the other health problems that the patient has. And for example, the comorbidities, the psychopharmacological interactions, there are so many things that you need to have in consideration that when patients are particularly complex, you require an expert. But that doesn't mean that this expert should not be concerned about population health at large or common mental health problems. We are, but sometimes you need to prioritize where to put stuff. And there are people that don't have this thorough training that are more focused in prevention or public health or public mental health. Still, in many countries and in many places, there's also like psychiatrists who are doing work on well-being, on mental health promotion. So it doesn't mean necessarily because you hopefully will become a psychiatrist that you can't work towards the mental health promotion or mental health prevention. And in the field of social psychiatry and community psychiatry, there's many psychiatrists in different countries that work towards that.
Thank you, Dr. Mariana. I hope that answered your question, Mohammed. I'm moving on now to another question, this time from Michelle from Hong Kong. Quote, in relation to COVID-19 and medical education, how do you think transitioning to online learning may affect medical students' mental health, and what support can university provide to their students? End of quote. The question is addressed to all the speakers, so whoever wants to respond, please feel free.
Okay.
Yeah. Okay.
And
Let me allow.
The Peter can continue. Okay, so the transition from in-class learning to online learning, it's a big transition, especially because it hasn't been done in a graded fashion. So there is such a huge turn from what we have known for centuries to something that is new. And as such, it's going to be quite difficult for people to adapt and sort of get on board with it. And one of the negative effects this might have, because in terms of in-class learning, there's a lot of support from your students, from your faculty members, and it's been shown that with in-class learning, there is more of a community kind of setting that promotes mental health and mental well-being, especially when you have difficulties. But with online learning, it's a bit more, it's not as personal as it should be, and then the interpersonal relationships and interpersonal skills tend to dwindle with time. And of course, all of these have some effects on mental health and well-being. And as Omar had asked his question, how does, you have lots of time on your hands and yet you're not as productive as you should be. But that's one of the problems with, doing it online, because it's more of a self-directed learning as opposed to being in a group of people who support each other through all of that. So what the university can do is actually, I think universities would have to set up, support systems that would constantly encourage the students. The curriculum, the medical curriculum would have to be adapted in a way to make sure that there are more group discussions, group homeworks, group assignments, to sort of keep that interpersonal relationship going. And that would actually help improve, it wouldn't solve the problem, but it would help improve it, to make it closer to in-class learning as possible. So these are some of the things that the university system can do. And of course, this is a trial phase for most medical schools. Medical education is done in class. So this is a trial phase for most, and there's going to be a lot of hitches and glitches along the way. And these are things that would have to constantly be improved as we go along. And hopefully, this is something that maybe in future it can be incorporated little by little, and we might go back to the normal in-class learning. But for the time being, I think it's a support system. I think the curriculum needs to be altered to allow for group discussions and group activities to sort of foster that learning, and then for each objectives and each learning objectives, if there are group activities, you sort of help each other along the way, so that when you have that free time, it's actually being used, it's more useful to you. So, yeah.
Thank you, Dr. Francis. Dr. Peter, would you like to add something? You are muted.
Oh dear, he's muted.
You are muted, Dr. Peter.
Oh, sorry. Dr. Francis has said almost everything I wanted to say, and I'm happy about the position. It reminds me of when I was doing my master's online, my master's in public health. The platform was so interactive that it was as if we were in a class. As a matter of fact, I made more friends during the online master's program than I would in a normal regular class. And today, I have friends in South Africa, I have friends in Brazil that I have personally, they've invited me and I've traveled out of the country and they hosted me. And today we are still very close. So that is to tell you that it depends on how it is structured. And that's why I love what she said. They must have it at the back of their mind that the online platform must have that group cohesion, must have that social support. I mean, there's a counselor room, you click the counseling room, you can be attended to. There's a group discussion that there's no instructor there. We all talk about the school, we talk about our experience, we made friends. And it was as if we were chatting after every lecture. And I believe this same platform can, I mean, I experienced that. And I believe that as much as possible, it is having that mindset. And if they think about it, university authorities and if they think about it, the psychosocial importance of bringing these things to online learning, it will help a lot. But if they don't think about that, we're just going to see syllabus, modules upon modules, submit your answer, go and submit your assignment, and that will be all.
Thank you, Dr. Peter. Yes, that was very well said. And I think that we can connect this with our conference with the Seems-like platform. It seems like we are actually there, one next to each other. So indeed, if one knows how to engage in an online setting, then this can be actually an advantage. Thank you both for answering. We have another question from Michelle from Brazil. Michelle, please go ahead.
Thank you, Matilda. My question relates to Michelle from Hong Kong, and it's like two-forked question. The first is, do you think that having a competence-based curriculum and very clear goals improves mental health among students, especially in these settings we are living now? And the other one is related to that, is if student engagement, so students that engage themselves with the changes that the curriculum has passed helps as well with their mental health, so they understand what they are going through. That's both questions.
Mm-hmm. Yeah, I can add a few thoughts on that. I guess in line with some of the remarks that were said already, I believe that it is quite possible for us to engage online, you know, like we are now. And I see that some people were already sharing their views over chat, and you are making questions. I'm seeing your face. You are particularly in a nice surrounding. There are some green spaces behind you, which is, you know, like totally fine. But all these things happen. Why? One, because I'm able to connect myself to the internet. Two, because I click the right buttons, you know, and I know how to engage in these platforms. And there are new competencies that we need to have and that we need to acquire to be able to engage. And engagement means that everyone feels engaged and it feels open. And this is not the same. You don't, the way that you get engagement in face-to-face interactions is quite diverse, as you engage people online, but also from a speaker perspective or from a share perspective or from a therapist perspective, it requires different competencies. So your question about education, I believe moving forward, because either things continually primarily online or they are hybrid, and sometimes they are face-to-face, sometimes is online. I personally don't think we're going back to 100% face-to-face. It's difficult because now lots of things were created online, and in many ways it has advantages. But on this respect, it also means that these competencies that are necessary for people to acquire, they need to be taught. They need to be taught in faculties of medicine. They need to be taught in different disciplines, which is, very important. Having said that, I'm concerned that medical students in some countries that aren't exposed to face-to-face interactions in many settings, visits in the ward with patients, the dynamics of, for example, inpatient wards, not only in psychiatry, but in all other specialties, which are so unique and sometimes so pressured, and you really need to see them and see how seniors cope with that as a role model perspective. That I think if you only have classes online, once you become a doctor and it's your time to manage, let's say, the ward, then it might be more challenging because you weren't exposed to that. So I think there are advantages in both models. I think they both require competencies, and we saw in our little interaction earlier today, sometimes, we can't put the slides and you still don't have the slides, and then there's this awkward silence, which is fine, but in psychiatry there are sometimes 20 interpretations for silent. Is it because you're too shy and you're not saying anything? Is it because you're very suspicious, or is because you're bored? So we can interpret even things like silent, and if we are interpreting these things online and sometimes we can't see faces and smiles or faces that show that you're somehow bored, you're losing information from the person with whom you're interacting. But at the same time, if we are going forward to be in some environments that by default or for different reasons, they are depriving you in these senses, then it's our role to acquire competencies to make sure that we engage as much as possible. And it wasn't the case today, but I've seen a number, for example, of teaching sessions for medical students, for example, that we as teachers put a number of polls and ask questions, and students need to click here or click there or click there, and you're always asking people to fill in whatever word. Why? Because you want to retain attention, because otherwise you're in a class that everyone puts the video off, and you don't know if you're speaking to people, you don't know who your students are, and it's the same to speak, to a black box than to a group of students that you're not seeing faces. So I guess it requires competencies, it requires that we adapt the way we interact, but on some circumstances, there should still be face-to-face exposure, especially if we're considering the education of someone who, once finishing the education, will become a medical doctor in a setting that might require responsibilities in face-to-face interaction. So these are some views I have. Your question was quite broad, and I think it was threefold. So I just shared a number of thoughts that I hope are useful for these reflections, of which, of course, I don't have an answer, but I have my own views. That's it. That's the other thing about the video. You never know when the person finished. I finished.
Thank you.
Okay, thank you so much, Dr. Mariana. That was a very complex answer. Does anyone else have a last question? Okay, I guess not. Then I guess we can, before calling it a night or an afternoon, And also, the Student Task Force puts an accent on mental health and on our members' well-being. And this year we have in place Mental Health Watch, and a support system for those who just need to talk to someone. I think it's like the first time maybe when something concrete exists in our team. So let's see how that goes. Yeah, that was more like an FYI. That I think would be it from our side. We are very happy, and once again, thank you so much for taking your time and being speakers in our side webinar. My appreciations on behalf of the team to Dr. Francis, Dr. Lamia, Dr. Peter, and Dr. Mariana. Thank you so much. And yes, that would be it from my side at least.
Thank you.
Thank you.
Thank you so much.
Thank you.
Good luck with everything.
Yes. Bye-bye.
Good evening, good afternoon, good morning. Bye-bye, everyone.